Hi, my name is Kemble. I'm the Executive Director of the Northwest Central FASD Network. Today we're going to be talking about the InReach program, a program that Northwest Central designed to provide FASD support services, assessment diagnostics, and supports in justice facilities in the Edmonton area. Today I have two ladies who are very integral to the program. We have Yvette Kraychy, who runs the sharing circles and the annual trainings. And we also have Donna, Kristiansen, who is the program manager. So first off, I'd like to give you a bit of a history about the program. We started in 2016 with a program called the RCMP FASD Training Program. And that was a partnership between Solicitor General and ourselves to provide FASD information and awareness and build relationships with the RCMP detachments in our region. So we had a lovely gentleman, Del August, who assisted with that, and it was a very successful program. We were very openly received by the detachments. They were very thankful of the information and knowing who to go to in the community when they did have a client that required supports for FASD and did become justice involved. Along with that program, we became aware that a lot of the people that we work with do become involved with the justice system and often wind up in justice facilities. And we knew that there were really no FASD services in those facilities. So on that note, we got invited to Edmonton Institute for Women to have a table at one of their Indigenous days. And we went to that with Central FASD Network. Betty Lou Benson was the executive director at the time. And while we were there and had the table, we had many residents come up to us, many staff come up to us and ask, do you do anything in facility? Do you provide FASD awareness education right within the justice facility? And at the time, we had to say, no, we didn't. Although we did think it would be something that would be very good for the facility and very good for the networks and would meet a definite gap in service. So once we did that, we talked with Valerie Gao, who was very passionate about having this information disseminated across her staff and to the residents. She saw it as very important. So we started talks then. Del August and I got invited down to present at an FASD conference in Calgary in early 2017. And while we were there presenting on the RCMP FASD training program, we had a lovely lady named Tammy Harris, who works at the Remand Center here in Edmonton, come up to us after our presentation and ask, do we do anything in facility? And again, at this time we had to say no. However, we are in talks with EIFW about bringing something into the facility. So she said she would be very interested in having us come in. And EIFW, it took a long time for us to get in there. There was a lot of, being a federal institute, there was a lot more paperwork to sign and people to ask permission. However, Remand managed to get us in there within about 6 months' time. So the first step we took was staff training. So we decided that before we did anything else in these facilities, we needed to provide FASD awareness and prevention training for the staff. And we also decided that it needed to be refreshed every single year. So that was one of the agreements we made with the Remand Center and EIFW, is that we would do the staff training and they would allow us to come in and do it again every single year. Because as you might know, FASD is continually being researched, more things are being found out and programs are changing, so we needed to keep them up to date. So we went into Remand and we did a staff training. It went very well. We were very flexible to what the facility's needs were. So for instance, in Remand they have shifts. They have 4 shifts. So we actually went in and did 4 different trainings for each shift to make sure that everybody was covered. We did that for the Remand Center and then eventually started that with EIFW. After everybody was trained, we were then able to do the sharing circles, which is people, the residents of the facilities sitting down and discussing FASD, getting some education and awareness on it, and we'll speak more in depth about that a little later. And so that started on generally a monthly basis, depending on the facility, what their programming is like. For instance, some have sort of 6-week cycles, so we'll go in every 6 weeks. Others we're able to get in there bi-monthly. And that doesn't mean just one circle for each facility once a month. They will rotate. So for instance, EIFW has minimum, medium, and maximum security, and a mental health ward as well. So they go in actually and do 4 circles in a month to be able to capture everybody. So we started with those 2 facilities, and then quickly Probably by the beginning of 2018, the other facilities started to hear about us, and on top of it, we reached out to the other facilities and managed to get Fort Saskatchewan on board with this program as well, and Edmonton Young Offenders Center as well, and Buffalo Sage Wellness Center. They were very interested in having us come down as well. So this program quickly expanded. And since that program has started, we've expanded to include not just the sharing circles for women, which is what we originally started out with, but we've expanded to include the sharing circles for men as well. And we have also identified a definite gap in our service in that the people that are in the justice facilities are often in need of an assessment. However, to get an assessment in facility was virtually impossible at the time. So we actually went to funders to get money to support doing assessment and diagnostics in facility, which we managed to do. We were very fortunate that Edmonton Community Foundation and the Status of Women Canada both saw fit to donate money to have people assessed right in facility. We'll discuss a little more about how those assessments in facility go and how they might look different from an assessment done outside. By the time 2019 rolled around, we had actually expanded the program to not just do awareness, prevention, education, sharing circles, assessments, diagnostics, and supports to our original 4 facilities, but to 11 facilities. Now, not all 11 facilities do every part of the program, but we have 11 facilities in total that do the program in some form or other. And we're constantly looking to expand more because the success of this program has shown us that the need is there and that the facilities are wanting us to come in and opening their doors to us. The timing is just right for this program, and we're consistently looking for funding to continue, and we're always on a cycle of continuous improvement, doing evaluations, making sure that we're meeting the needs of the clients where they're at. The next expansion that we are looking at is doing outreach services for women and men who have been released from facility so that there is a smooth transition from services in facility to services outside of the facility. One of the things that the justice facilities have mentioned to us is that once they leave here, being the justice facility, they often don't have any connections to supports in the community. They're often going back to exactly the same environment that helped to cause the situation that led them to prison in the first place. And there wasn't a lot of connection between supports within facility and supports without. So we realized that in order to reduce recidivism, we needed to make sure that there was a smooth transition to community with supports. So that next piece of our puzzle is to ensure that there is outreach supports for people that are being released. So in essence, that is the history of the program to date. And now I'm going to ask my fellow co-workers here a couple of questions. My first question will be for Donna. I'd like you to describe the annual staff training, what it looks like, and why it's so important to do it prior to the beginning of the sharing circles. And why it's important to be refreshed every single year.
Well, it's important for the staff training so that they're aware prior to the sharing circles, because after the sharing circles there may be individuals or residents that are going to be having conversations with the parole or with the staff in regards to FASD or accessing some services. So prior to them having that information, we thought it'd be best to have the staff have those that education. And basically, we go in there, we have a PowerPoint, and we just describe FASD, some of the symptoms, some of the all the 10 brain domains and how they're impacted, and how that transitions into behaviors and what that might look like. Another thing is, in regards to that, by having that information, they are also, when they have that kind of connection between what the behaviors may look like, it kind of changes the attitudes. So rather than looking at a resident that maybe they're doing certain things maybe on purpose or intentionally, they start to maybe have that change of mindset to look at it as maybe there's something else going on here. Maybe there's maybe I need to look further. Maybe it's not that they won't, it's maybe more that they can't. and that sometimes those behaviors might look like they're being oppositional, but sometimes it's a deflection. You'd rather look bad rather than looking like you have ignorance or not knowing. So it's kind of all those things that being, looking tough when you're maybe in a facility amongst other residents as well. So, those are some of the reasons that we want to have that training. The reason we have it regular and ongoing training is because facility staff leave. They may go to a different facility or change jobs, things like that. So you have newcomers come in who may not have that information, so it's always good to refresh. And there's a lot of aspects to FASD. And so to be able to say, okay, I've had the training once, I'm good to go, is typically not how it happens. Sometimes it has to seep in a little bit of information at a time. So it's not that you're going to get a whole bunch of information and always remember all these aspects. And FASD is actually really, when we come to the diagnosis, is fairly new, really, compared to others. And we're always learning as well. We're learning new strategies, we're having more connections, all those pieces, whether it's other services that may be outside the facility that the staff may not know about. So it's like just kind of making those connections as well.
I imagine it goes a lot towards relationship building with the staff as well. And you mentioned sort of that shift in attitude or perception of what an inmate might be doing and why. So maybe looking to create a bit of a paradigm shift in how the staff are dealing with the residents. Is there a hope there that with this training there is a chance that maybe FASD accommodations are going to be made to programming?
Exactly, and to be able to look at how they are doing that programming, and when they look at release, and when these individuals are released, what's on the other side? What are, where are they going to? So kind of looking at, like, typically if somebody is incarcerated and when they leave facility, it's kind of left for them to put all those pieces together and access those services independently. So maybe having a shift that say, well, maybe, and that's how the conversation came with looking at services outside of the facility, and how can we make that connection for them? Because often these are the individuals that are going through that rotating door and coming back, and nothing has changed for them.
So hopes for more FASD inclusive programming. And I imagine that when people do attend the sharing circles, it can be a pretty emotional experience. And it would almost be unethical to not train staff on how to deal with some of those outcomes, because you go in, you do your sharing circle, and then you get to leave. And then the staff are left dealing with potentially an emotional resident who may have realized that she's drank with all of her children, and that might be why they're struggling. So we want to give them as much support as we can to the staff to be able to provide that support to the residents. My next question is for Yvette, who does run the sharing circles. And I'd like to point out that these are FASD sharing circles, not Indigenous sharing circles. We do always ask the facilities to, if they are able, to provide a knowledge keeper or an elder so that they can actually become full-fledged, proper Indigenous sharing circles. Not always is that possible, so we call them FASD sharing circles. Just wanted to point that out. Yvette, can you tell us a bit about the sharing circle, how you go about making a plan for a sharing circle, and some of the results you've seen in residents who have attended a sharing circle?
Yeah, so first off, we start with meeting up with the coordinator in each facility, and each facility is different, so it's finding that main contact. And then from there, we pick some dates, we communicate through emails and phone calls, and we find the dates that work best for the women, because each facility is extremely busy and they have schooling and classes and stuff and so forth. So we go from there and we connect with the coordinators and we pick the dates, like I said, and then from there we move into the circles. So in some facilities we have to send in what we're going to be doing. So we'll send in our files of all of the information that we're going to share with the women. And we host the circles. Some of them are really small and some are quite large.
What is, do you have a cap on how many you like to have in a circle?
We technically like to keep it at approximately 15 max, but sometimes we go above, depending on the facility. Yeah. And the smaller circles are great, because when they're smaller, we have a lot more engagement. So if they're larger, we find that the women sometimes have side conversations and so forth. But when they're smaller, they're engaging, they're sharing their stories, and they're telling us what they know about FASD and what they want to know. And this is where
I can imagine it's pretty interesting what they know about FASD already, and I can imagine not all of it is correct, because as we've experienced, you can go right to the top professionals and hear some pretty interesting stories about what FASD is. How long are your sharing circles about?
Usually with an hour, sometimes more, it depends on facility. And in that hour, we do the main focus on what is FASD, the strategies, solutions, and then we go into conversations on breaking down those stigmatisms, because there's so many stigmatisms out there that we find the women don't want to connect or engage because they feel like they're being judged.
What would you say the top 3 goals of the sharing circle are?
For us, it's reaching the women and making the connection, and then doing the follow through of sharing that information and engaging them. So explaining to them where to get resources, how to get an assessment and diagnosis, and how to support families who are at risk of having FASD.
Okay, well, thank you very much for that. I've already pointed out that we have excellent funders in Edmonton Community Foundation and the Status of Women Canada. We're continually pursuing funds to make this a sustainable program. I have another question here for Donna. This is with regards to clinic. Now, we have adult clinics, of course, within our network, and they are run a certain way. To do an assessment in facility, although a lot of it is the same, there are some tweaks that need to be made and definitely some barriers that needed to be crossed in order to get that assessment done in facility. I'm going to hand it over to Donna to give us a little a brief summary of what's needed to be done to make this successful.
Well, the difference is in facility is one is to be able to have access to internet. So typically our clinic team, which is a fabulous team that we have our psychologist, Monty Nelson, and we have 2 physicians that also assist, is Dr. Nadeau and Dr. Winterback, and we have our occupational therapist, which is Sharon Britnell from the University of Alberta, and it's just a fabulous team and willing to make some of those accommodations. So it's like looking at those pieces of not maybe having that technology. Another big thing is security. So to be able to have everybody have those security checks to go in there. Scheduling is another big one. So to make sure that everybody is there that needs to be and certain times. So they usually typically book a day for each individual that's getting an assessment for psychological assessment. Then they book another day for the occupational assessment. And then they schedule for a formulation meeting, which includes the clinic team and our clinic coordinator and our resident and anybody that maybe would be beneficial, but that's the main core. And so they do that formulation that way, and that's where some of those challenges are in regards to the technology. But they are able to get it done using the facilities web service that they have. Another thing that is different is, well, sometimes, and this is actually a positive, is that when we have assessments outside facility, having the individual ready for those assessments and finding where are they supposed to be where they are when we go to collect them to take them for the assessment. They maybe not be where they are, but in facility, you know they're going to be there. So that's one of the positive things of that.
Yeah, definitely doing the assessments in facility can be a lot easier because you always know where your people are. One of the barriers that I remember is just the actual geography of a facility often doesn't have 2 usable rooms side by side. And then, of course, there's the security while that resident is doing their assessment. And then there's the programming within the facility, such as lunches at a certain time, and everybody has to be within their cells at a certain time. So the level of flexibility required to do this successfully must be very high.
It is high, but you know you've got everybody there that wants the same thing. We have facility staff that's had the training, has a very good understanding of the positive aspects of having an FASD assessment. We have our clinic team that is accommodating, and so when everybody is trying to just make that little bit of shift to try to make it work, it works. You know, like I say, it's a little bit more time consuming, a lot more thought has to go into it, into arranging those things, but we've got some fabulous facility staff that go out of their way. And I guess that's one of the key thing too, when we have that collaboration, when we have the training, is building those relationships and having those champions within facilities, so we have that individual, because sometimes, there's a lot of staff that work in facility. It's finding the right person to connect to be able to help facilitate, to have the sharing circles, to have the trainings, to get the assessments done. And so we're very
Well, I'm so
thankful.
glad you mentioned relationship, because from what you've told me and what I've seen, one of the biggest reasons for success is the groundwork you guys have done in building relationship with key people in the facility. Obviously, their passion to have you come in and do this program. It's obvious that it's needed there, but their willingness to open the door, shuffle things around, make things work. One of the goals of this program was to make it so that it's repeatable by other organizations, because as we know, there's justice facilities right across Canada. A good number of people with FASD do become justice involved, so you can only imagine there's a relatively high percentage of people right now that are incarcerated that are suspected or diagnosed of FASD. So to be able to get this program into all of the facilities, we needed to create almost a template to make it replicable across the board. Would you say that relationship with the facility is probably one of the most key things required to make this happen?
I agree.
Yeah.
I think it's really important because without that connection, we're kind of being tossed around. And then when too many people are in on it, then there's miscommunication and then things aren't getting set up appropriately.
Okay.
So in some facilities, we found that we should just break it down and have two main individuals or one, and to make those connections.
Okay. And have you had lots of success with making those relationships strong with the facilities you're actually in?
Yes, we have definitely. They're really engaging. They're always like reaching out and saying, hey, this is working. The girls are really liking it. What can we do to help you? And then we just kind of build off that. So we're always making other game plans and putting stuff into our profiles and stuff to share with them. And we're finding what they need and what's resourceful.
So it sounds like you're always on the lookout for ways to improve and incorporate the gained knowledge and make changes. So it sounds like it's, well, dare I say, organic, but also as you identify a need, you work hard on what you can do best to fill that need as it arises.
Yeah.
No, it's great. So relationship, flexibility, fabulous stuff. Edmonton Community Foundation has actually given us second-year funding, and they allowed us $10,000 to do an evaluation of this program, which we have undertaken with Melissa Tremblay. And I'm just going to hand it over to Donna to discuss some of the key things that we're hoping to discover out of this evaluation and why it's so important.
Well, we always want to be able to track, what we're doing, is it the right way to do it. It's also with having that evaluation and being able to get the answers we're looking for, it helps us move on to be able to develop the most robust program. Part of when we have that evaluation, we're asking the people that are actually accessing this service, the residents and facility, we're asking them the questions like, what did you like about the sharing circle? What more do you want from the sharing circle? Do you know more about FASD because of the sharing circle? Do you, have somebody that you can contact outside a facility in regards to accessing services when you're released? We're asking also the facility staff what they think, and it helps us to identify what's working really, really well, and where's the gaps, and what are we missing, and how can we improve it. So we're always evaluating our service and how can we improve that services to be able to hit those pillars of success in the prevention and awareness of FASD, and also the assessment and diagnosis, so we can help individuals get those assessments and diagnosis, because often there's so many individuals that are in their 30s and 20s, 30s, 40s that have so far never had an assessment, always recognized there was something going on, and very frustrated and experiencing some depression and all those other things that can come along with that, and some of that decision making, and saying, why am I here again? And so when they have that diagnosis, it's like this can answer a lot of questions, or even when they find out about FASD and thinking, wow, I do that, or that's happened to me. So it's really fabulous. So about the diagnosis, we want to make sure that we are hitting that target, but also at the end, the supports. Whether it's in facility, whether it's transitioning out of facility, at the end of the day, we want to be able to assist individuals have a wholesome life or a better life, rather than going in that cycle over and over and over again without actually accessing the services and somebody to help them reach their full potential.
And I can imagine the expansion to include outreach and following that resident once they're released, especially if they are halfway through an assessment and they get released. I imagine that happens. And to connect with the network that they're going to and say, we've done the psych report, can you follow up and do the OT and finish their assessment? Or, and if that's not possible, we actually as a network will go and do that. And then connecting them with the supports in their community to hopefully reduce the recidivism rate and help that person lead a more successful life that is accommodated for their needs.
Because it happens lots. We have individuals who are transitioned to a different facility and then they've missed that area. So then with us knowing where they're going, then we can reach out to them and continue it from there.
And unlike what often happens is once you're released, everything gets dropped. I liken it similar to when somebody transitions from childhood to adult, and there is often a break in supports at that point, and it's the same thing for people in facility. You get your food, you get the roof over your head, you get good night's sleep, you get your health care taken care of, you get supports, you have programming, and then all of a sudden you're back out in potentially the community that helped to create the situation that led you to prison in the first place, and you've got nothing, which no wonder people wind up reoffending or winding back up in the system. In closing, I'd like to thank Donna and Yvette for joining me today and for you for watching this presentation of our InReach project created and implemented by Northwest Central FASD Network in justice facilities in the Edmonton area. This program has served a very large need of an identified gap in service between FASD awareness, prevention, education, assessment, diagnostics, and supports in and out of facility. And it has been very, very successful. The goals of this program are to reduce recidivism, FASD-affected births, increase the support for the individual, and to create safer communities. This program is designed to be replicable so that you can take it to facilities in your region, across Canada, and goodness knows where it could lead to. We are always looking for funding to keep this program sustainable and also to be able to expand to even more facilities and add new aspects to the program as those gaps in service are identified. As always, continual cycle of improvement, and we're always evaluating and addressing based on the new knowledge we're receiving. So thank you very much for joining us today.